Hey, this is Ashley Hall, and this is my 5-minute video lecture series for Auburn University's Nurse Practitioner Program. My topic of interest is heart failure, and a definition of heart failure is the inability of the heart to fill or pump blood efficiently to meet the oxygen demands of your body tissues. People at risk for this diagnosis include coronary artery disease and hypertension. 80% of patients with a heart failure diagnosis have either or CAD or hypertension. Additionally, diabetes, valvular disease, obesity, and old age put you at risk for heart failure. 3 key questions you want to ask your patients. Number 1, weight gain. Have they gained weight? I don't really like to ask that one because not everybody owns a scale. So have you noticed that your clothes are fitting tighter? Do you feel like you have shrunk things in the washing machine, or your socks tighter? Do you have tighter pants despite the fact that you haven't changed your diet or eating process? Those are because not everybody can just say, yo, well, I've gained weight. Another one that's important, dyspnea on exertion. Can you walk to your car from Walmart in the parking lot? Can you walk from your car to the store without getting short of breath? Because that's a big sign of heart failure, because the heart failure patients have shortness of breath because the heart is having such a hard time trying to keep up. Orthopnea and nocturnal dyspnea. Do you sleep on pillows at night? A lot of times patients will say, yeah, well, I developed this cold, or I had a cold last winter, and I had the drainage, and so I started sleeping on a pillow because I just coughed and coughed and coughed. Cough is a big symptom of heart failure as well. So those are 3 things to look for. The 3 physical examination components you want to look at are your heart, your lungs, and your peripheral, your circulatory. Number 1, your heart tones may be muffled. Your point of maximal impulse may be shifted because of enlarged heart. Hypotension, tachycardia, narrow pulse pressure, those are all symptoms of poor cardiac output that you want to look for. Rales and wheezes in the lungs, because when the patients do become congested and get fluid volume overloaded, the lungs get the edema in them, and so you'll have rales and wheezes. Also, peripheral edema is there swelling in the ankles, arms, legs, fingers, toes, that kind of thing. So those are important things to look at. The most common treatments for this diagnosis is to correct and treat risk factors, diet modification, no added salt, decrease your fluid intake to less than 2 liters a day, and even more restriction than that based on the patient. Smoking cessation is a big one. You don't want to smoke if you have heart disease. Smoking causes worsened heart disease. Activities as tolerated. Weight loss is a big thing because you'll take that pressure off the heart as well. Medications, diuretics is usually what they start with when the patients are acutely congested or fluid volume overloaded, but they are not effective alone in management and maintenance of heart failure. You need to add an ACE inhibitor, which inhibits the angiotensin converting enzyme converting to angiotensin. But these medicines aren't always tolerated real well. They can cause cough. It's kind of like a dry nagging that lasts a long time. Or even life-threatening angioedema and shock from anaphylaxis. If that's the case and they don't tolerate an ACE inhibitor, in addition to your diuretic, you want to give an ARB, which prevents the angiotensin from binding to the receptor site. So both of those drugs decrease afterload in patients with heart failure, and mortality has been shown to decrease significantly, up to 70% in those patients who are taking those. Beta blockers are also a good drug because they help increase that myocardial contractility to help that heart pump that blood out. But you titrate those for heart rate rather than just a specific dose. So every patient, each patient's going to be on their own dose based on how well they tolerate that beta blocker. Digoxin used to be used a lot in heart failure, but it's shown not to reduce symptoms or mortality, so they're not really using it as much as they used to. Patients who have an ejection fraction less than 30 potentially probably need a defibrillator, an implanted cardiac defibrillator, to prevent sudden cardiac death from ventricular tachycardia or VFib. The 3 teaching components that I really want to hit home with: number 1, medication compliance. It's very important that patients pick up their prescriptions and fill them and take them as directed, because if you don't take your medicines, you won't stay out of heart failure. They'll end up right back in the hospital. These patients should weigh daily. Do they have a scale? So those patients you asked earlier about, are you gaining weight? If they don't have a scale, we need to get them one. Weigh daily and keep a log, because something is insignificant to you or me or a healthy heart as 2 pounds in a day or 5 pounds in a week, which that's significant to me, but is very important to a heart failure patient because they can be in fluid volume overload. Diet modification, no added salt, decrease your fluid intake. We talked about we want to buy fresh fruits and vegetables from the outside ring of the grocery store, nothing from the inner side, because inside is your canned, processed, frozen stuff that's full of sodium and salt, full of preservative, whereas your fresh stuff is on the outside. So nutrition consult may be necessary as well, because they can help them. It's expensive to buy fresh fruits and vegetables and foods, so it's much cheaper to buy that processed stuff. So maybe helping them with that, starting a diet plan. And then that's it. So weigh daily, diet modification, and medication compliance are all real important. So thank you very much. I hope you've enjoyed my video, and have a great weekend. Bye.